Thank you so much for everyone who has joined the conference so far. Welcome to our webinar, virtual webinar called Prescribing Change. My name is Lucy Manukyan, and I'm the CEO of Health For Armenia. And for those of you who don't know much about Health For Armenia, we are an organization that was set up several years ago on the Teach For Armenia model. And we're here to build a new generation of healthcare leaders. We recognize that Armenia's current healthcare situation is challenging, with a lot of overemphasis on infrastructure and quantity, with focus on overtreatment instead of prevention. Our healthcare system is expensive and inefficient, and it lacks capacity at the right level in the right places. And we believe that the way that we can solve this is by building the next generation of healthcare leaders in Armenia, and particularly women leaders, because we know that the majority of the primary care workforce is women in Armenia. So we see the real potential there for them to create real change in this country. And we are doing that by running our healthcare leadership program, which is a 2-year intensive leadership development program for primary care physicians and particularly family medicine doctors who are based in rural communities. And you will hear a little bit later from one of our doctor leaders, Dr. Anush Sargsyan, who's joining us today. Today is also dedicated specifically to our fundraiser, which aims to raise 8,000 USD. It's called She Leads, Armenia Heals. We will share the link throughout this webinar, and we will share it both in the chat, but also you will see it on your screens at various points during the webinar, and you'll be able to scan the QR code and donate if you feel so inclined. Would absolutely appreciate your support, and every penny, every cent will go to supporting women leaders in Armenian rural communities. So without further ado, I'd like to introduce our moderator for the day, for the evening. I suppose it's Dr. Susan Jerian, who is the founder and CEO of Oncord, and who has been instrumental in helping us get the support that we need at Health for Armenia, but also who's done incredible work over the last 10 years in Armenia through the Max Foundation and through volunteering for many other efforts. Susan, we're so privileged to have you here with us. Thank you so much, and I will let you take over.
Thank you, Lucy. It's such a privilege to be here and with this incredible panel of strong leaders. I learned about Health for Armenia a couple of years ago, and I can honestly say it is the most exciting healthcare project that I've seen in Armenia. I think this program is going to achieve sustainable impact in Armenia. It's coming from within the country. It's from within the heart of the people, and I'm truly excited about what the future holds. So we're here today. I'm going to go right to the panel, and I'm going to ask each panelist to please briefly introduce yourself to the audience. And let's start with Dr. Anush Sargsyan, who is a participant in the HFA program. Anush, please go ahead.
Hello, everyone. I'm Anush Sargsyan. I am a family physician and doctor leader. I'm working on Masha Health Center.
Thank you, Anush. And can we next go to Irina Gazarian?
Hi, everyone. I'm very happy to be in this panel. It's an honor for me. I'm Irina. I'm co-founder of Dr. Yan, which is one of the first marketplaces, healthcare marketplaces here in Armenia. We proudly serve to every 6th doctor here in the country, and right now expanding into Central Asian market.
Thank you very much. Dr. Narik Arkun.
Yes, hi everyone. Thank you for having me today. I'm a neuropathologist. I work at Tufts Medical Center in Boston. I'm a director of neuropathology and autopsy services. I'm chair of WIMS, it's Women in Medicine and Science. And I'm also a board member of AIWA. Thank you.
Thank you. And Dr. Lorki Labaridian.
Hi, everyone. Thanks for having me. I am an internist and pediatrician with a background in quality from Boston. I moved to Armenia 4 years ago. In addition to being on the board of HFA, I also work with a number of other organizations, COAF, Pediatric Residency Program of Armenia, and consult for some other organizations as well.
Fantastic. Thank you to everybody. So throughout the session, we'll be doing some questions to the panelists. We'll take a brief break partway through to remind everybody that they're in the link. In the chat, there is a link for making donations. And at the end, we will try to have some time for question and answer from the audience. If you have questions that you're thinking of along the way, you can add them in the chat, in the Q&A box. If you look at the bottom of your screen, there's a little box with a question mark that says Q&A. You can click on that at any time and enter your question. And when we get to that part of the session, we'll try to get to as many questions as we can. So let's start off to the panel. And I'm going to go by first names if that's okay with everybody. So Lorky, please, you've been doing so much amazing work in healthcare across the board, and I'll be asking everybody to comment on this question. There's all kinds of challenges. Technology is coming in, changing how medicine is done, funding gaps, burnout because not enough personnel. From your perspective, what are you seeing as the most urgent challenge in Armenia for healthcare? And what is the role that women have in helping meet those challenges?
Thanks, Susan. As we were talking about before, I feel like each of these questions is a massive thesis. But I would say the greatest challenge we have is the shift in the way we think about health and healthcare. It's not the technology. Technology is important. All these things are important, but it's really how we think about how we build that system. And that is not a small little jump or shift or list of checkboxes. It's an entire shift in how we envision things, how we look at processes and outcomes, how we determine and then stick with and align our priorities. So I think it's really different than just something that's a tangible object. The reason we ask about women is because they haven't been at the table. Otherwise, we wouldn't be having this discussion. I think in Armenia, we've made a lot of headway with that. We have a female minister of health. We have deputy ministers of health who are women, and primary care is often dominated by women. But I think in addition to that, we have room to grow. But it's also what we bring to that table. Do we as women and everybody else, this doesn't go just for women, but especially for women, are we bringing to the table the needs of all women and what they are, and talking about it in an open, transparent, and an effective way? So I think that's also part of that culture shift, is how we have that conversation. But it is absolutely critical that we talk about those needs and those changes that have to happen for everyone, but especially women, when we are at the table.
And how have you seen your perspective on healthcare in Armenia shift?
Wow, there's a lot to talk about that. I think my perspective has often been the same on a large scale. The mechanisms have changed, but over time I realized more and more just how important it is that we build a system. It has to be about system, it has to be about implementation, and it has to be about how we look at whether or not we're effective, and always looking for how we can improve, which means we need data, we need transparency, and we need collaboration. And more so than ever, every day I realize that that is fundamental, and without it, we really won't be able to make the progress we need.
Brilliant, brilliant. And Narik, can you also weigh in? What are you seeing as urgent challenges in Armenia?
So being actually trained in Yerevan in Armenia and then moved to America. So looking back, I think two big things: that healthcare for all and accessible high quality. I think it's still a question and a problem. We do have healthcare, but can everyone access it? even though it's not expensive, it's still expensive for people and they cannot access that. So that's like a still very big question. And I agree with Lorgi and echoing her that systemic changes and reforms still needed so we can go through these reforms and establish that care. And it's like such a big field. And with that, for example, there was no residency, and still there's like no residency. I think Lork is trying to build. So after you graduate, just you thrown, or you have to pay to do internship, or you just go and start working without no one giving you residency. And here, as you know, we have residency that's from 3 to 7 years. So you're still in a training and people training you, and then you take the board exam. So that's all quality of the care will be. And then the other thing, I think like thirdly, it will be this difference between rural and urban areas where we have the healthcare providers, which brings you to the primary care and how important people like Anush are, and that we need to train them first to bring the primary care up, so we don't have this discrepancy between the rural and urban quality of healthcare. I think those like quickly like 3 big points.
Excellent, excellent. And Anush, can you share with us, since you're out in the rural communities, can you share with us what you're seeing as the biggest challenges for healthcare in the Marses?
As I work in Armenia Health Center, I face two main problems. One is with the healthcare workers, and the other is one with the patients. We serve 90 villages. This makes teamwork hard and screening rates low. Most of the staff are over 16. It's hard for them to use computer skill, learn it, and learn new skills. Moreover, many people do not about checkups, health checkups, and lack awareness. So they only come to the clinic when they are sick. Because the diseases are found late. So I think that fact many healthcare workers are women. So it is important to have women in leadership. Women leaders have make better and fair decisions.
And how do you feel that being in the HFA program is helping you become a physician leader? What is different about this program?
Program helped me to be more patient and colleagues, and improve my time management skills and thinking skills, explain things clearly, most importantly, and the most important is be a leader who leads beyond their position. I have a program. Last summer in Armenia, we organized an event about the role of family doctors for my community. I was skeptical about ability to pull it off, but thanks to the skills I got on the program, I was able to negotiate the space, the funding for invite many patients, and the event was success with over 100 attendants. I think all this possible because we had a very specific goal and had a step-by-step plan. And I learned if you have support and if you have smart goals, you can do more than you imagine.
Outstanding. Anush, congratulations. I think that's incredible. You're doing terrific work. We're really proud of you. And now I want to go to Irina. You are tackling a specific problem, a specific challenge in Armenia. And maybe you can share with us, what are you seeing as the most urgent challenges?
Yeah, one of the challenges that we see, and especially when we compare it to, for example, European countries, we can see inconsistency in quality. So, for example, when we compare platforms like we have to platforms that are, for example, in France, people do not choose a doctor going very deep into the details, asking friends, do you think he's a good doctor, etc. If the doctor is qualified and certified and works in a specific hospital, then he is a certified and doctor I can go to. In Armenia, and not only in Armenia for sure, but also in post-Soviet countries, that doesn't work that way. Having a diploma and working in a hospital doesn't make you a doctor, doesn't necessarily make you a doctor everyone would go to. No, we need to double check with everyone. And that comes from the universities, from probably the continuous medical education that very often is like just on paper. When during my very first pitches of doctorate, I was saying that this is not like going to see a doctor is not just a logistics thing. Like it's not just I need to go and see a doctor like from A to B. It's a very deep and personal process you go through. And even like when talking to Gen Zs, we often compare it with dating because like if you go to wrong doctor, you spend your time, money, everything, and you get very frustrated. And that unfortunately very often happens in this region because you never know if that's the right doctor for you. I think that quality, inconsistency, and the uncertainty when you go see a doctor is a very major challenge. And that's why we have superstar doctors, that's what we call them, doctors who see 400 patients a month or 500 patients a month. And there are doctors who don't see that many because of many, many reasons. And then there is imbalance, and then there is that imbalance between Yerevan and regions, etc., etc.
And for your program, do you vet the doctors that are included in your app?
So we vet them. Yeah, we make sure they're real doctors, so they are certified doctors. But most of the ratings and reviews come from patients. So once your visit is completed, patients can rate their doctor. Unfortunately, Armenians are not very keen to, rate their visits. So we spend a lot of effort and energy asking them to rate review. For most of the cases, if patient is happy with their result, they would just say, thanks God for this doctor, like something very emotional, not kind of a constructive feedback, like doctor helped me to treat this. And they get very emotional when they are not happy with the doctor. So it's very hard to collect, rational, constructive data that we can later analyze to build specific doctor profile, like to say, this is this kind of a doctor you can approach, but we're working on it.
Wonderful. Fantastic. Congratulations, Irina. And I look forward to seeing all the countries that you're going to expand to.
Hopefully, yeah.
Amazing.
Yeah.
I see lots of data coming out of this for Lorky. And also, I'm hearing a theme here, which is, I think Lorky started it off with how we think about healthcare in Armenia and how we think about health. And that it's not just about going to the doctor when we're sick. It's about maintaining health and maintaining healthy lifestyles. So this is very good. Lorky, I'm going to go back to you. So they say there's a difference between being in healthcare and leading in healthcare. They're very different things. You've obviously been involved in so many different things. You've somehow found out how to get 25 hours out of a 24-hour day. So kudos to you on that. What was the moment you realized that the system needed you specifically as a decision maker, as a leader, and not just a participant? This is for Lorky.
You may not like the answer, but I don't think I ever realized that the system needed me. I think any system I've been in, I've had questions and wondered, and thought, what if we did it this way? Or why is it done this way? And I think I'm just naturally curious, and that's always been encouraged since I was a kid. Except one teacher, I remember, stop asking why. Why do you ask that so much, Lorky? Aside from that, the others all encouraged me. And that continued, and it continued through my studies. And then when I went and when I was a resident, and then when I was first out of residency, I started doing that in the system that I was in. So I don't think I never thought of it, and I still don't, as the system needs me. I think maybe sometimes, every once in a while, the question I ask goes down a path that the systems goes, that might be helpful. And she seems to want to go down it, so go for it. And I think that's how I've ended up where I am.
Very good advice. Thank you. And Nadik, your career spans your time in Armenia and your time in the United States. When did you feel the call to be a leader and step up to a leadership role in medicine?
Yeah, it's as Lorky said, it's kind of you never have that day that you thought here's the day, but I always had that there's a time to give back after you have your education and working as attending and kind of everything come down, kids are grown, and then you realize it's time to give back to, when you got all this and seeing the opportunities. I don't want to say seeing the problems, but that's also like one of the things, and seeing that you can make a difference, not just for yourself, but for entire group, for many other people. And then you like step in and try to make a change and the difference. I think that's where Anush says, like, I'm a leader. Even she's leading just a small group, just the two nurses and her office. I think that's a like really big leadership as well. It's not necessary to lead, like when she shows up to work, that's already being a leader. And of course, and then you have the other changes that you can make for larger group, for bigger changes, systemic change. So we all leaders and on a different level. And I think the system needs all of us.
Excellent. Thank you so much. Next question is for Irina. You took a bold step in starting your business. Can you share with us a little bit what got you to the point of saying, I'm going to do this, I can do this, and I can be a leader that helps improve the healthcare system?
It is a nice story. I actually love the story because it includes my dad in it. So I'm coming from a family of doctors, and my dad, my grandfather, my grandmother, like my whole family are doctors. And I'm not. I'm an architect by background. But at some point, I started working as a designer, and I was working remotely in a US company that was doing remote patient monitoring. And I was very much fascinated with what kind of a big system we're building. Like I was very involved in the whole processes, how doctors were remotely like managing all their patient data, like with some different devices that were connected to with APIs to our platform. And I was continuously like showing my dad, like, you see how good this is built, like what we're building. And after another, I think like it was 2 a.m. call from patient, like, can I come next morning? Because Armenians love to call in the middle of the night to get an appointment next morning. He said, this is cool, but if you could do something so that patients don't call doctors. Like this was the initial idea, like the spark that it all started. And in the very beginning, I wasn't thinking that I'm starting like a business or that we're like going to change the healthcare, all these things. I just thought that I can design and build a platform that can does this kind of a job. Like that doesn't sound very hard. It all started sound very hard when I was already like approaching doctors, trying to make them pay for the product. I was seeing like hospital CEOs, etc. But in the very beginning, I think, and that's the most beautiful part when you're just starting, when you don't realize how hard it's going to be at some point, and you are very much motivated just to see how it goes, and then I'll figure it out.
Wow. Okay. So your father must be sleeping better now.
Hopefully, yeah. At least he does all his appointments in our platform, so I'm happy. Yeah.
Terrific. Very good. Okay, thank you. And the next question is for Anush. Actually, so can you tell us how you lead, other ways that you lead in your community now that you're going through this curriculum with HFA? And I want to share with everybody, I've actually done a very deep dive into the curriculum that HFA has. It is phenomenal. And the concept of how they teach physicians to become physician leaders and the hands-on aspects of it, the mentoring is just terrific. And Anush, do you see yourself as potentially one day being a leader within the HFA program and training other doctors who go through HFA?
As a doctor, we all learn all our life. So why do not learn about from the best? This is a creative opportunity for others, for every family physician to become a more skilled, adopted innovation and stay informed about international experience. I learned in HFA be more հայերենում տենց ավելի լավ բառ կա, դիմակայուն անգլերեն ուղղակի լավ չի թարգմանվում կա, եթե օգնեք։
Resilient.
Հա,
Resilient leader.
More
resilient
resilient.
leader.
Very good. Thank you, Anish. We're going to take a quick pause here. I just want to remind everybody that in the chat is a link for donations. And I think they're going to be projecting on the screen here a QR code. You can also scan the QR code and use that to make donations. The goal is 8,000. I think we can definitely get there. And I hope everybody is learning something from this session and that you have a deeper sense of not just what the challenges are in Armenia, but what these amazing leaders are doing to meet those challenges, to change the system, change in a good way. There's all kinds of change. We want good change. And I think HFA has developed something that will be sustainable. So please, if you can, consider making a donation to support this really important program. So we're going to go back to the questions for our second round of questions. So Anush, I'm going to start with you. So women living and working in the rural, underserved regions of Armenia, where, for example, where you are working, what is one concrete thing, whether it's a policy, a program, a resource that would help change the direction for those women to get them in a better direction in their life? And Anush, can you comment on that, please?
When I was started in Armenia, I faced problems because people did not know about cervical cancer and screenings. I even gave free lectures, but I saw that many people did not want to learn about facts and about screenings and about cervical cancer and cancer too. So I formed a team that included my director, a gynecology nurse, my nurse, a village nurse, and they help us raise awareness about healthy lifestyle. And we went from village to village offering pap smear tests. We ended up going to 16 villages, testing over 140 women who knew little about cervical cancer before this. In fact, 25% of Armenia's healthcare workers don't know about the cause of cervical cancer is the human papilloma virus. So what we really need is focus on awareness raising so people are better informed.
That is outstanding. And just for everybody's knowledge, so cervical cancer is a very treatable, preventable disease. Unfortunately, in Armenia, very few girls are vaccinated with the HPV vaccine. It's only about 30%. The WHO goal is 90%. And then for cervical cancer screening with the pap smear, you know, again, it's about 30%, and the goal there is at least 70 to 90%. So there's some progress made the last few years, but there's a long way to go. And Anush, I think what you're doing is key to getting women into the system to prevent them from having cancer, such a treatable cancer. And obviously I'm an oncologist, so this is near and dear to my heart. that you're doing this work. Thank you so much for the women in Armenia.
Now in Armenia, pap smear is not screening for HPV vaccine. There is screen by HPV test.
Yes. And what about the girls being vaccinated with the HPV vaccine?
13 years to 15 years, guys.
Okay, thank you very much. Lorky, I'm going to ask you the same question from your standpoint. And I know you've answered this on some level already, but what do you see as some concrete thing that will help women advance, particularly in the rural regions?
That's a great question. It's a really broad question. What do we consider advancement, in what field, which women? Anush kind of mentioned the younger women, so let me just kind of pivot to older women, right? Older women in rural areas are often the grandmothers, the caretakers, and they don't really get a break. They're often doing a lot of the work, just keeping the home together. And in some ways, the grandmothers are, not to be overly sentimental, but the foundations of our society in many ways. And a group of us did a study, actually, and we brought integrated care, so social work, psychology, into primary care. And one of the things that they did was they did group work with older women with diabetes and taught them about their own health and their own wellness, and did anything from education to arts and drawing to all types of kind of self-awareness work. We did a study around it, and what we found in the focus groups and by talking to the participants was amazing. They said, I feel like my old self again. I feel like a real person again. I want to take care of myself now, or I know how to take care of myself now. And this is huge when we think about, technically in rural Armenia, I should be a grandmother. I'm 47. I'm not currently, but this is the age, we're talking about 45 and up. The women in our group were older than that. But, we need to take care of the women and the girls across the entire age spectrum. And they all play a crucial role. And hearing women literally say, I feel like my old self again. I feel like a real person again. And that might sound like it's not medicine, but it is the entire wellness of that person and the health of that person. And you will never improve someone's physical health if they don't have good overall, wellness. And so I think having some type of integrated approach where we help women and support them in valuing themselves and give them the time and the resources. And those resources are not just conversations with an integrated care team, but the time to actually sit down and value themselves and think about, okay, how do I care for my diabetes? How can I do this? How can I manage my blood pressure better for myself and for my family? We've actually proven that it's effective and it's appreciated.
That's beautiful. Yeah, I think that at least the little time I've spent in the Mars is the women are clearly the backbone of the communities. They have a lot on their shoulders. That is a tremendous burden to them, but letting them find themselves in that stress that they're under, that's an amazing gift. Fantastic.
And I would say that feeds right back into the family and the community.
Yes, for sure. For sure. Okay, very good. Let me go next to, I'm going to be asking Irina and Narik a question. Irina, how are you envisioning the future of women in leadership roles in Armenia now that you've become a leader yourself and innovator? What do you see could be the direction for women in healthcare in Armenia?
That's actually a hard question for me to answer because it's not that it's very straightforward, how to do this. It's not like an easy path, but what I see now is there are so many different programs that help women to at least start. Like we participated in different programs, like UN Women program who was operating in Armenia. There are many programs by GIZ that actually help women to start, and it's not just in healthcare. There were like even if women want to start their small businesses in rural areas, like they're making some candies or they're doing something. It's always very hard to go like outside of what you were used to do and start thinking bigger and start doing something. But what I always believed in is that success cases and stories, this is the biggest, like, I would say, driving force. And as many people as could see, like Anush's example, they would say, I want to be like her. I want to do like this. And I think what Health For Armenia is doing is basically like opening this path, this route for other female, or not only female, but also other leaders to go over this path. And what I wish so much for Health For Armenia is the scale, so that it's not just 20, 30, 40, but it's like 400, 500 people all across Armenia. I think healthcare is very open to female leaders. I know many successful women in healthcare in Armenia. I know like primary care hospital CEOs who are amazing. They're doing amazing job. They're doing their best. I know doctors. And when I'm looking on international market, I always feel very angry when I see female health related products owned and founded by men. I'm like, why? So like we should have done this before them. And I really hope that women will be the ones who will be like pioneers in starting the changes and yeah, becoming examples for future generation female leaders.
That's beautiful. And you're in a very unique position because you're interacting with so many physicians
Yeah.
across different towns, villages, cities. So you have a perspective that's totally unique. Excellent. And Nanik, what do you think? What are you envisioning? Women physicians in Armenia, what can their role be at the leadership? Do we think we can have a rector who is a woman one day?
I think we should try. At Tufts, we just elected Helen Boucher. In 129 years, she's the first one. So I think it's coming maybe for Armenia too. I mean, even here in America, it's even at Tufts in Boston, it took 129 years for her to have a female rector. She's the dean of our medical school. I think it's a really hard, tough question. And even in America, when system is still relatively working better than in Armenia, and we have established residency and the way promotion works, and we have electronic medical records, we have better equipment, we have advancing to the AI and have like a better stuff like going on. We still have same problems. We still have problems such as a gender pay gap that going on. So for surgeons paid more than primary care or pediatrics, kind of known fact. And even if you paid the same, they calculated for America that in 40 years of your career, the woman will get underpaid for $1 or $2 million compared to the male. I think it's the same problem going to be there. The other problem, trying to learn to negotiate, that Anush had to learn, trying to know how these political games work and navigating it. So learning the business, because now you're running a business like Irina doing, going through second shift, because being a female, not being a doctor, just being a even female, but doctor females, they have second or third shift, because when they go home, they have to put 100% at work being a doctor, and then they go home and then they have to do their second and third shift. And the other one is maternity tax or maternity penalty, that we all want to have family and mothers, and we have to take time off and take care of that. So those are all the same problems come back. It doesn't matter where you are in America or in Armenia. And I think Health for Armenia trying to tackle educational part of it pretty well. And there is also the executive part that they probably, if they add to it, that will be excellent, because what they do here in America, they send you to the conference, which is like a mid-career or early career conference, which teaches those skills that Health for Armenia offering. And of course, separately, we have educational courses and annual conferences where we go to maintain our knowledge and to learn like all this new innovation, educational research stuff that we have. So this is all, I think, if Health for Armenia, I see them trying to incorporate whatever they're doing now, plus to add some executive features to their program. I think they'll be like a perfect people where Armenian women leaders can grow and thrive.
Yeah, excellent. And I like that you acknowledge that when you're a physician in a leadership role too, you're leading in multiple aspects of your life. It's not just at the hospital. It's when you come home at the end of the day. It's in the middle of the night when you have a child who's waking up or a patient who's calling in an emergency. It's a 24/7 existence, and how to navigate all of that and provide the grace and the leadership on a daily basis that helps other people.
Burnout is real, yes, and I can see
Yes.
how it can it's everywhere, not just for us. And being a woman, I think it's doubling your chances of being a burnout, right? So I think it's
Mm-hmm.
true. That's also like a teaching to recognize and have this work balance. Also, we have like other things that we dealing in Armenia that you need like improve the quality of care that we already talk about, and giving like a more educational classes and better residency and better support for our physicians that they can do better job every day.
Yeah, I think one of the exciting things in healthcare is there's so many different things that we can each do. It's not just one specialized area. There's so many ways to be a leader in healthcare. There's so many ways to participate in advancing the system. And I love, 20 years ago, I first heard this quote, and I think it was President Truman in the United States. He said, "It's amazing what you can accomplish if you don't worry about who gets the credit." And I love this quote because I have found it true in my life. I just go forward and do the work, and it doesn't matter who gets the credit, and then the results flow like crazy from that.
Yeah, I like
Yeah.
that. So you see the goal, as Anu said, it gets easy when you see the goal, when you know you have a vision and you have a goal, you go through that goal. And and then that gets easy. And then you know why you're putting this hard work for. And then if you don't do it, then someone else like are gonna do things that it's not right for you. So why, if you know what's the problem, where's the opportunity to lead and do that, so it can be done right way.
Yes, very good. And I'm going to remind everybody, if you have questions, please put them in the Q&A. I think there was a question at one point. I'm just going to go right into Q&A right now from the audience if there are any questions. There was a question about the smoking problem in Armenia. And that, anyone who's visited Armenia, this permeates all of society. It is contributing to, the high morbidity and mortality rates in men in particular, but also women and children, contributes to, asthma problems in children from secondhand smoke. Lorky, can you speak to us a little bit about initiatives that have been started in Armenia to help combat this problem, and then what role women can play in helping address the issue?
Yeah, smoking is a huge, huge problem, as most of you know. It directly contributes to cardiovascular disease. 50-something% of our premature morbidity and mortality, which is early illness and death, is from cardiovascular disease or heart and blood vessels. And a lot of that is related to smoking. All the smoking also obviously contributes to to many cancers, and we have some pretty high cancer rates. Armenia, a couple of years ago, through a big push from the prior Minister of Health, said, okay, no more smoking in public places, cafes, restaurants, even bars, even on their patios. That has mostly held true, but unfortunately, it has not held true completely. We do see people smoking on the outdoor patio of a cafe or a restaurant. Sometimes you'll even see it almost indoors, just kind of in the doorway. Unfortunately, I've actually also seen it within a government building, somebody smoking while they walk through the government building. There were guards there. They didn't say anything. When I said something, I caught up to that person and said something, and his response was "Lave manum," which basically translates into like, yeah, so what? Good, I'm doing it. So what? I think the role of all of them, I think our role in general is to make sure that we all understand as a society the harmful effects of smoking. We still have people who are like, well, I didn't get COVID because my lungs are coated they're protected from the tobacco smoking. There are a lot of these types of things. That's not the only one. So we need to be clear about, the harmful effects, like you said, first, secondhand, and even third hand. And it's not just, even episodes of bronchiolitis in children are impacted by having smokers in the house. So it's not just asthma, it's more than just that. It's many more, ear infections, etc. But I often wonder what if the diaspora and healthcare system, instead of pushing more technology, more buildings, or had one less conference, actually came together and said, for a healthy Armenia, we need to cut down our smoking. And we need to not only have laws, but we need to enforce those laws. Those are words, they're videos, they're campaigns, they're education. They don't cost too much compared to a lot of the resources that have gone in, but I think the impact had the potential to be huge.
Yeah.
And I don't see it. Unfortunately, not enough, at least, compared to what we could have done. In terms of women's role, I think a well-designed and orchestrated campaign for education and quitting would have to have women part of it and would also empower women in the home when you have a smoker in the home. Now I think what we have, I don't know the numbers off the top of my head, but we have more women smoking now than before, say 20 years ago at least, or 30 years ago. But the numbers are still lower than men, the men's rate of smoking. And I think if we could help the woman say, no, we're not smoking in this house near my baby, and many other things. I mean, I'm just saying that off the top of my head, but if we could empower families, and that includes women, not just obviously the physicians and healthcare workers and nurses, but to have them feel that that is an important thing to say and it's okay to say it. And actually, it's a good thing to say. Maybe we'd have a little bit more of a difference.
Mm-hmm. It sounds like a multidisciplinary
Absolutely.
challenge that we
Yeah, I
need
mean,
lawyers, we need legislators, we need
yeah.
activists, we need public relations people, social workers, right?
Yep. And, there was a great question in the chat about smoking, and Lucy gave a great answer. I would also add to that the approach with the HFA docs is really, really broad. And in terms of that medical component or the how to talk to the community about it, I mean, Anush talked about going and engaging with the community actively, but also just how to talk to patients. And that talking to patients about health relates not just to the very important point of smoking, but also how do I manage my high blood pressure? Or what does it mean to manage my cardiovascular risk or my diabetes? Or what does it mean to do a screening? Because as a physician in the US, I come across this all the time. I feel fine. Why do I need to go get my pap smear or my mammogram or my colonoscopy? I feel fine. I'm great. Why do I need to go do something? So that approach about talking about that and educating the doctor leaders about it, but also how to talk to people about it, talk to patients about it, is part of the entire approach of HFA.
Yeah, that's fantastic. There's a question and a comment, I think, in these. So there's a question. Thank you for holding, this is from Laura. Thank you for holding this important space. I'm curious about the perspective and experience of the women doctors relating to fellow male colleagues. Is there friction? Is there allyship, support, and other hurdles around creating more meaningful shared power and respect for women in this sphere? So let me see. Let's go to Nadi. What are your thoughts on that question?
So, well, we want to have their support. So whatever we do, so we want our male colleagues support. So we can't do it on ourselves, just by ourselves, the stuff. So we really need to engage them and have their support. So I personally don't think that they're against us or anything, but I think just really working in involving in all projects, whatever we do, I think is the key, collaborating and listening, and not just doing things separately. I think that will help us because we really definitely need their support. I just want to go back to whatever Lorki and Anush was saying about whatever I hear, like a smoking and people like really don't know about the health, about pap smear. So it's all preventive care. So I think that's other thing that we really all heard a lot, like a preventive care, it's lacking as well, and how to bring it up. So maybe it will involve like a more of the campaigns, more government involvement and everyone's involvement. And maybe this is the time to involve everyone, including male colleagues, to have going forward. We can't just do only us. Yes, women make good leaders, but we also have males. It's 50-50, right? And currently it looks like a more of primary care and pediatrics, as usually it's like a female, but we do have still our male colleagues, and we need to keep in mind to involve them with all whatever we're doing.
And I just want to point out that Health for Armenia is for men and women. We're celebrating women leaders today, but there are also excellent men in the program as well. Anush, can you comment a little bit about your experience interacting with men doctors, male doctors in Armenia? Do you feel that you can have a good collaborative relationship with the men?
We also have in our group men doctors, Taron Shaghoyan and Taron Kasparian in HFA, doctor leaders. So when I have a question about library or something else, I call them because they are do some physical and some new skills and something very interesting about something about cases my in practice or about law.
Very good. So there's a question in the chat. How long is the fundraising campaign active? Thank you for asking that question. The fundraising campaign is open through April 7th. So you have plenty of time to participate in the fundraising. And I see we're coming close to the top of the hour. I'm going to do one last round, quick question for everybody. So I would like everyone to please share 3 words, literally words, 3, to describe your vision for how the work of HFA is going to transform the future of healthcare in Armenia. When you think of what HFA is doing now, the innovation of this program and what it's trying to achieve, what 3 words come to mind as you think 10 years, 20 years into the future? And I'm going to start with Irina for this question.
I would say trust, care, and skill.
Trust, care, and skill. Beautiful. Anush, do you have 3 words for us about the future with HFA?
leadership, community, and prevention.
Leadership, community, and prevention. Outstanding. Nadik?
It's probably sentence, high quality care. That's my expectations.
High quality care, in fact, a key to all of this. And Lorky, please close us off with your 3 words.
Proof of concept. It can be done.
Fantastic. You know, I have to say, I've had a tremendous time. I want to thank the audience and all the panelists. This was a fantastic discussion, and I'm going to turn it back over to Lucy to give some closing comments.
Great. Thanks so much, Susan, for your amazing chairing and for a really interesting discussion. I, for sure, for myself, was really, really engrossed. And thank you so much, everyone, for your really thoughtful answers to some really tough questions about Armenia's current reality. And it's so incredible to hear the support that we have for Health for Armenia's programs and the faith that you have all put into our work. And we're really grateful for all the donations we've received so far. And if you feel so inclined, we would love for you to support us further, whether that's through current link or in the future. We have so much faith in our doctor leaders and their ability to create change. We know that these young physicians are going to be the future of Armenia, and not just in terms of preventing preventive healthcare in their communities, but actually in terms of creating change at a systemic level. We expect them to be the next, directors of clinics, the next policymakers, and why not deputy ministers and even Minister of Health. We have seen that change is possible. Lorky said proof of concept. Our proof of concept is Teach for Armenia and the incredible change that we have seen in the education sector as a result of their work. And we know that similar change is possible in the healthcare sector. We're so grateful for your support and for your time. Thank you for being here with us. If you can spare, any amount, we would be extremely grateful for your support. And if not, if you're a physician yourself, or if you're a leader and you want to contribute to our program in other ways, like teaching on the program, most of our, lecturers, professors who teach on the program do this pro bono, and we wouldn't be able to do it without their support. So if you're interested in engaging with the program in other ways, or if you're interested in supporting HFA in other ways, please reach out to us, drop us a line, follow us on our social media, and let us know if you want to be involved, because we'd love to hear from you. Thank you so much once again, Susan, for your amazing chairing. Thank you, colleagues Kanarik, Lorky, Anush, and Irina, for joining us and for giving us your time this evening and morning and afternoon. We have 3 different time zones on this webinar, so incredibly grateful to you all. Hope you all have a wonderful rest of your days or evenings, and we hope to see you soon again.
Thank you so much. Thank you for having us.
Thank you.
Thank you.
Bye-bye.
Bye-bye, everyone.